rapid access to comprehensive oncology data and survival analysis. This is the OncoToolkit.
Hello everyone. Today I saw a patient who had recently undergone transurethral resection for non-muscle-invasive bladder cancer and had started intravesical BCG treatment. He asked, "Doctor, what is my risk of the cancer coming back or getting worse?" Rather than making an estimate based on a single factor, let's take a closer look. Our patient is a 66-year-old man with recurrent non-muscle-invasive bladder cancer, receiving intravesical BCG therapy. He has 4 bladder tumors. Pathology shows T1 disease with WHO 1973 grade 2 histology. There is no associated carcinoma in situ. Let's assess this case using the CUETO Risk Score Calculator in the OncoToolkit. The CUETO Risk Score was specifically developed for patients with non-muscle-invasive bladder cancer treated with BCG. Let's enter our patient's information. First, select the patient's sex. We'll select male. Next, select the age group. He is 66 years old. We'll choose 60 to 70 years, inclusive. Now, select the previous tumor status. This patient has recurrent bladder cancer. We'll choose recurrent tumor. Next, enter the number of tumors. He has 4 bladder tumors. We'll select 4 or more tumors. Now, select the T category. Pathology confirms T1 disease. We'll choose T1. Next, indicate whether there is associated carcinoma in situ. No associated CIS is present. We'll select absent. Finally, select the WHO 1973 tumor grade. The pathology report shows grade 2. We'll choose G2. Now click Calculate Score. Here are the results. The recurrence score is 8 out of 16. This corresponds to a historical recurrence probability of 25.36% at 1 year, 39.61% at 2 years, and 47.65% at 5 years. The progression score is 7 out of 14. This corresponds to a historical progression probability of 5.55% at 1 year, 11.95% at 2 years, and 21.26% at 5 years. These estimates are based on the original 2009 CUETO cohort of BCG-treated patients. They are historical cohort probabilities rather than individualized predictions, current guideline risk groups, or treatment recommendations. To see how the results were calculated, expand how this result was calculated. The calculator assigns recurrence and progression points separately based on 7 clinical and pathological variables, including sex, age, previous tumor status, tumor number, T category, associated CIS, and WHO 1973 tumor grade. For this patient, these findings produce a recurrence score of 8 and a progression score of 7. You can click Copy Result to copy the assessment. To save it, enter the patient's name and click Save. Previously saved assessments can be viewed from the Saved Results panel on the right-hand side. If you'd like to learn more, scroll down to the reference data below. The CUETO model provides historical recurrence and progression probabilities for patients with BCG-treated non-muscle-invasive bladder cancer. Compared with the EORTC tables, it often provides more appropriate risk estimates for patients who have received BCG therapy. Content reference: OAIA site. Index 0. The clinical workflow section provides guidance on how these results should be interpreted in practice. The CUETO risk score should always be considered together with cystoscopic findings, pathology review, response to BCG therapy, and current clinical guidelines. For more oncology calculators and clinical decision support tools, explore the OncoToolkit.